The other thing that we learned about the biology is if we wanted to prevent the cancer, a lot of women elected to have risk-reducing surgery because there was no way of identifying the ovarian cancer early. There's a way of identifying breast cancer early, but there was no way of identifying ovarian cancer early. People were trying. But so from these risk-reducing surgeries, it's obvious that ovarian cancer a lot of times does not start in the ovary. It starts in the tubes. It starts in tubes, which has great implications to the biology. First of all, the ones that start in the tubes are high-grade serous. And high-grade serous is the majority of the ovarian cancers, but they're not all of them. But the high-grade serous, they all have certain common defects. The other thing is high-grade serous, well, if they start in the tubes, they get to the ovary. Well, they get to the ovary they are very close, but they also jump from one organ to another, and they like the peritoneal cavity. That's a great environment. They spread in the peritoneal cavity. So all of a sudden, it's given us an idea of why we had all these difficulties before, how to guide the therapeutics, and also to focus on the molecular subtypes. So you asked the right question, why we're focused on BRCA genes, because that's one target we know. And in ovarian cancer, there haven't been too many other targeted therapies. We still rely on the true and tested chemotherapies. And we can't explain why. Part of it is it's a disease where drug development has not been easy. The other is when you have a chemotherapy regimen that wipes out the disease in advanced circumstances about 80 to 90% of the time, how do you make the progress? Slowly. And how do you identify other targets? How do you improve on that? Well, it wipes it out, and we need to improve it because it wipes it out, but the disease comes back. So that's our challenge. But the fact that these drugs work very well is inhibited in part. Others, it's the biology, the targets are not very clear. But the BRCA genes are certainly one, and the PARP inhibitors have become a very good target to explore further.